Hack Immunopharmacology, immunostimulants. Immunostimulants are drugs that enhance or activate the immune system. They are used when the immune system needs to be boosted or restored, particularly in patients with immune suppression. Major clinical uses. Immunostimulants are commonly used in immunodeficiency disorders, cancer therapy, bone marrow suppression, recovery after chemotherapy. These drugs mainly work by stimulating the production or activation of immune cells. Number 1. Colony-stimulating factors, CSFs. Colony-stimulating factors are drugs that stimulate the bone marrow to produce immune cells. They are particularly important in patients receiving chemotherapy, where bone marrow suppression frequently occurs. GCSF, granulocyte colony-stimulating factor. Example, filgrastim. Mechanism of action: stimulates the bone marrow, increases neutrophil production. Result: increase in neutrophil count. Clinical uses: used for treatment of chemotherapy-induced neutropenia. Also used for bone marrow transplant recovery, severe neutropenia. Important clinical effect: filgrastim reduces the risk of serious bacterial infections in patients undergoing chemotherapy. GM-CSF, granulocyte macrophage colony stimulating factor. Example, sargramostim. Mechanism: stimulates production of granulocytes, macrophages. Clinical uses: bone marrow recovery, stem cell transplantation, chemotherapy-induced bone marrow suppression. Number 2, interleukin drugs. Interleukins are cytokines that regulate immune cell activity. Therapeutic interleukins are mainly used in cancer immunotherapy. Interleukin 2 example, aldesleukin. Mechanism of action: stimulates activation and proliferation of T lymphocytes, natural killer NK cells. Result: enhanced anti-tumor immune response. Clinical uses: treatment of metastatic renal cell carcinoma, metastatic melanoma. Important adverse effects: capillary leak syndrome, hypotension, edema. Interleukin 11 example, oprelvekin mechanism: stimulates megakaryocyte maturation in bone marrow. Result: increased platelet production. Clinical use: treatment of chemotherapy-induced thrombocytopenia. High-yield exam table, drug, target effect, clinical use: filgrastim, GCSF receptor, neutrophils, chemotherapy neutropenia, sargramostim, GM-CSF receptor, granulocytes and macrophages, bone marrow recovery, aldesleukin, IL-2 receptor, T cells and NK cells, metastatic cancers, oprelvekin, IL-11 receptor, platelets, chemotherapy thrombocytopenia, ultra-high-yield exam pearls. 1. Filgrastim increases neutrophils. 2. Sargramostim increases granulocytes and macrophages. 3. Aldesleukin activates T cells and NK cells. 4. Oprelvekin increases platelets. 5. IL-2 therapy is used for metastatic melanoma and renal cell carcinoma. Key concept: immunostimulants are mainly used to restore immune function in patients with suppressed bone marrow or cancer, especially after chemotherapy, by increasing production of neutrophils, macrophages, T cells, NK cells, or platelets.